So, welcome back. Today, we're diving into chapter 10, the urinary system. This is a much shorter chapter, therefore, the PowerPoint will be much shorter. So, by the end of the lecture, you should be able to identify the core functions of the urinary system, recognize structure terms, and decode diagnostic, surgical, and therapeutic procedures. So we start when we look at urine flow, we start at the kidneys, which filter the blood. Urine travels down the ureters, which are the long tubes connecting the kidneys to the bladder. It then collects in the bladder, our storage sac, and finally exits the body through the urethra. Looking closely at the hilum, this is the indented notch where the renal artery, renal vein, and ureter enter and exit the organ. Notice also the renal pelvis acts like a funnel collecting urine from the renal pyramids before it enters the ureter. The root for renal pelvis is pylo, so you'll see that again. So the kidneys regulate blood pressure by managing blood volume and releasing hormones. They stimulate erythrocytes. So those are red blood cells produced by secreting a hormone called erythropoietin. The patient has chronic kidney failure. They often will also have chronic anemia for the exact same reason. So these are some terms. There's a few less, so I am going to go over a few of them. Uro or urino both mean urine or the urinary tract. Urea is the highly common suffix meaning condition of urine or urination. Oligo means few or scanty. If you combine oligo with urea, you get oligoria, which is scanty or abnormally low urine volume. Glycose, we've discussed this before, that means sugar. Therefore, glycosuria is sugar in the urine. Okay, so some double roots here, pay close attention. The kidney has two distinct roots, nephro, Greek origin, and reno is a Latin origin. Usually we use nephro for diseases, conditions like nephritis, and reno for anatomical descriptions like renal artery. Other essential roots are cysto, bladder or sac, pylo-renal pelvis, and glomerulo, which is glomerulus, the microscopic filtering unit in the kidneys. Here is a knowledge check, and then we have a brain break. Remember to get up, get a snack, move around during these breaks to re-energize your brain so you can be ready for more learning. We're going to move into diseases and disorders now. So polycystic kidney disease, PKD, poly meaning many, cyst meaning sac or fluid collection, and ick meaning pertaining to. So this is essentially a genetic disorder characterized by growth of numerous fluid-filled sacs in the kidneys. This results in very high blood pressure, which must be managed. Nephromalacia is nephro-kidney plus malacia, abnormal softening. So make a note that the opposite of this is nephrosclerosis, which is the hardening of the kidney. Nephrolithiasis is nephro-kidney plus lith, stone, and yiasis, which is condition. So it's basically a condition having to do with kidney stones. Nephritis is the broad term for inflammation of the kidneys. Glomerulonephritis is highly specific inflammation involving the microscopic clusters of blood vessels called the glomeruli. If these filters are inflamed, they leak substances that shouldn't be in the urine, leading to some of our next concepts. So, renal insufficiency is suboptimal kidney function. Intermediate stage before total failure, it still sustains life. Renal failure is severe impairment. Kidneys can no longer filter waste products from the blood. Acute renal failure, remember acute means sudden. So there's a sudden rapid decline in function, often reversible, however, if underlying cause is treated. When we look at chronic renal failure, this is long term, progressive, and irreversible decline over months and years. Uremia, uremia is toxic blood condition, uri waste plus emia blood condition caused by advanced renal failure. Waste builds up in the blood instead of leaking into the urine. This can also lead to uremic frost on the body, which is like a white dusting coat. Nephrotoxic is poisonous to the kidney cells, so we can have nephrotoxic drugs. The biggest ones are some of the antibiotics, gentamicin, and that is why we do have to do a peak and trough on those. So you have nephro, which is kidney plus toxic and poisonous, and this can also be caused by NSAIDs and heavy metals. So, urea family, let's compare these four critical clinical conditions. Dysuria is painful or difficult, plus urea, urination. Polyuria is poly, many and excessive, plus urination. Oliguria is olig, which is scanty or few, plus urea. Anuria is a or an, which is without or absence of, plus urea. Just make a clinical note here, anuria is an absolute medical emergency indicating full shutdown or major substructural blockage of the urinary tract. Incontinence versus retention, these are exact opposites. Incontinence is the inability to hold in urine, so that could be stress incontinence, and this is involuntary leaking. Retention is the inability to let it out. The bladder fills up but cannot empty it. Here's a little knowledge check. So we've got to find the problem and try to fix it right now. So we're moving into diagnostics and interventions. Urinalysis, or UA, is the everyday screening. It's a very common test done in the hospital or in the clinic. Culture and sensitivity, CNS, shows signs of infection. A urine culture is ordered to grow out the specific bacteria. This must be taken before antibiotics are started. Then an antibiotic sensitivity test is run to see which specific medications will successfully kill that pathogen. We look at blood urea nitrogen, abbreviated BUN or BUN. Even though it assesses kidney health, BUN is a blood test, not a urine test. So when the kidney filters are compromised, things spill into the urine that shouldn't be there. For instance, hematuria is hemato, which is blood plus urea. Pyuria, which is pyo, pus plus urea. This indicates a highly active infection. Ketonuria, which are ketones in the urine, and this occurs when the body breaks down fat for energy instead of carbohydrates, and it's heavily seen in uncontrolled diabetes. So dialysis is used when kidneys fail. Therefore, the body must clean the blood artificially. Hemodialysis is hemo, blood, plus dialysis, separation and filtering. Blood is cycled directly through an external machine. Peritoneal dialysis uses the patient's own abdominal lining, the peritoneum, as the filtering membrane. Immunosuppressive therapy is performed after a renal transplant because we must suppress the immune system so it doesn't attack and reject the new foreign organ. So when we look at these vital surgical suffixes, ectomy means surgical removal, as in nephrectomy. Laparo, which is abdomen and abdominal wall. A laparoscopic nephrectomy is a minimally invasive removal through tiny keyhole incisions used with a camera scope. So this is the preferred procedural intervention because it's least invasive. Pexy means surgical fixation or anchoring into place. A nephropexy anchors a displaced or slipping kidney back where it belongs. Lithotripsy, and we discussed this in our last chapter. This one is specifically looking at the procedure that uses shock waves from outside the body to smash stones. Lithotrite is a tool suffix. Trite means instrument for crushing. Um, so when we look at these two terms at the end, we see the difference is just that root word of nephro meaning kidney and pylo meaning renal pelvis, but it also includes the tomy, um, which is the surgical incision. So, looking at ectomy versus ostomy, cystectomy is the removal of the bladder. A cystomy is creating a permanent or semi permanent artificial opening in the mouth stoma into the bladder for drainage. A uretroplasty is means a surgical repair or reconstruction, and it's used to fix a narrowed or collapsed ureter. Percutaneous, when we break that down, it's per through plus cutaneo, skin, and us pertaining to. A percutaneous renal biopsy means putting a sampling needle directly through the skin of the back into the kidneys. A nephrostomy is creating an artificial opening directly between the skin and the kidney to bypass a blocked ureter entirely. So, a catheter is simply a hollow tube used to drain fluid. A catheterized urine specimen is the gold standard for urine cultures because it pulls directly from the bladder via a sterile tube. It avoids any normal skin bacteria contamination on the way out. However, you have to talk to the doctor about what they prefer. Here's a little knowledge check. Another one. And so this wraps up our deep dive into the urinary system. Be sure to look over your chapter root tables and also use your textbook tools as well as your notebook tools to study.